Resuming debate, the honourable member for Foothills.
Thank you very much, Mr. Speaker, and I'm glad that my colleague from Saanishkoff Islands brought up this emergency debate today. But I do recall being in this House in January having a similar emergency debate on the inability of the Liberal government to access and distribute vaccines, putting the impetus on the provinces and the potential of a third wave. I definitely don't want to be back here in May or June or July having a third emergency debate on the Liberal government's inability to procure and distribute vaccines to the provinces to ensure that every Canadian is vaccinated. I'm going to go in a bit of a different direction than other speakers have this evening, Mr. Speaker, because of a phone conversation I had yesterday afternoon. I had one of my constituents, a 19-year-old girl, call me wanting to have a discussion about her brother. Unfortunately, her brother committed suicide. Her brother committed suicide because of the isolation, losing jobs, the inability to see his friends and his family. And that is just one of many stories that I know all of us in this House have had from constituents. This is a 20-year-old young man who had his whole life in front of him. But after a year of lockdowns and quarantines and restrictions, the mental health impacts on his life was just too much for him to bear. We can't have those stories any longer. This cannot be the new normal. Canadians need hope that there is an end to this crisis. The mental health implications of the COVID pandemic are frightening. We saw the report from the Canadian Mental Health Association in December where almost 50% of Canadians had reported that their mental health has deteriorated. That's 6 months ago. I'm sure that number is much higher. We have seen an incredible increase in domestic abuse, suicides, opioid overdose deaths. Certainly in my province of Alberta, we saw skyrocketing numbers in terms of the opioid crisis, and our suicide numbers tripled over a two-quarter period late last year. Canadians have had enough. But what is most frustrating with the impact that this has had on Canadians' mental health, Mr. Speaker, is that this could have been prevented. A year ago, we were asking the Liberal government to ensure that they had agreements and contracts in place to procure vaccines that Canadians would need. In November and December, the Prime Minister stood on the podium and said, you know what, we're going to have all of these vaccines, millions of vaccines for Canadians. But through January and February and March, Canadians weren't being vaccinated at anywhere near the rate of our G7 counterparts and countries certainly around the world. As a result of that inability to meet the most basic needs of a federal government to ensure the safety of its constituents, Canadians are dying as a result of not only of COVID-19, but of mental health crisis. So I know the current government wants to say, well, you can't go back in the past. But the past often dictates where we're going in the future. It is very clear that the Liberal government's inability to access and procure vaccines is rooted in the mistakes they made a year ago. When they were putting their faith in an agreement with the Chinese Communist Party and the CanSino agreement that, to shock of no one, fell through last summer, having the Prime Minister and his procurement minister scrambling hat in hand to those pharmaceutical companies asking for whatever we could get. And as a result of that, we see where we are right now. We see where other countries like the United Kingdom, the United States, have been vaccinating their citizens at a much quicker pace. But they also had very strict guidelines in the contracts that they signed with those pharmaceutical companies to ensure that those pharmaceutical companies, if they did not meet their delivery commitments, there were consequences. Financial, in most cases financial, but certainly they had to make those reports transparent on a monthly basis. But we don't know here in Canada if we have similar contracts signed with Moderna, AstraZeneca, Pfizer, because the Liberal government has refused to share those contracts with the Canadian public. And I think the Canadian public deserves to know exactly where we stand. Other countries have shared those contracts with their citizens. In fact, the United States has one of the contracts that we signed, and they know what's in that contract, and they've made it public, but Canadians here at home aren't allowed to see those contracts because the Liberal government is blocking that information. We had a motion here in this House in October that was passed unanimously by this House to ensure that all documents and information regarding the COVID pandemic and the response was provided to parliamentarians. Those documents have been trickling out, but we still haven't had an opportunity to see those contracts. So I put a motion in front of the Health Committee more than a month ago now, asking specifically if the law clerk has those contracts, and if not, that he prioritize accessing those contracts from the government. It's been almost 6 weeks and we still have not seen those contracts at Health Committee. Now, I'm not naive. I know there will be information redacted. That's why we asked it to go to the law clerk before it's redacted by the government. And there may definitely be some information in there that's sensitive that the government and those pharmaceutical companies do not want to share. But I think it behooves the government to show Canadians the contracts that they've signed. Because now we're in this Liberal government third wave that could have been prevented had they been able to procure and distribute vaccines months before. And I know in question period today, and I'm sure in the debate tonight we'll hear it some more about this disagreement in facts, but the facts are that only 2% of Canadians have had 2 doses of the vaccine. 2%. Where in the United States it's close to 30%. And in some states are going to the 3rd shot already as a booster. Incredible when you see the difference that we've seen in this country compared to others. And not to mention, I heard it yesterday from a pundit on the news that we're spending like a first world country, but getting third world results. And I couldn't think of a better anecdote or better description of what we're seeing. We learned last Friday, thanks to some research from my staff, Mark Choi, who was able to find out what we were paying for an AstraZeneca vaccine, for example. In Canada, we're spending $8 for an AstraZeneca vaccine. And I know many Canadians say, I don't care what it takes, we want that to happen, and I agree. But in the United Kingdom, or in the United States, it's $4. In the EU, it's $2. So we're spending, in many cases, triple, double, what other countries are paying, and yet we're not getting those vaccines. So if I'm paying a premium, I expect premium service, and we're not getting that. And now we're seeing the provinces having to struggle and try and find ways to vaccinate their citizenry. And also, we're one of the only countries in the world, Mr. Speaker, that has gone off label and saying to our Canadians and our constituents that you won't get that second dose until 4 months down the road. And we've asked Pfizer, does this meet your requirements? Is this still going to be acceptable? And they won't answer that question because they don't know. They don't want to make that commitment. So we are continuing to roll this out when only 2% of Canadians have had both their vaccines, and now we're waiting 4 months for that second dose. That's unacceptable. And that is poor leadership and poor action or inaction by this government. And they have to apologize to Canadians because we can't keep this up. As I said, Mr. Speaker, this cannot be the new normal. Our mental health and financial health just cannot take this much longer. We've been on this roller coaster ride, or I'd like to say a hamster wheel, for a year. And I commend Canadians, and I certainly commend my constituents for how they have handled what has been a very, very difficult time. But I think, Mr. Speaker, we have asked Canadians to do a lot. But there is a breaking point. And as I said, we have seen that breaking point with many Canadians as our mental health continues to deteriorate. And I just want to end with this, Mr. Speaker, if I may. Last year, we approached many Canadian pharmaceutical companies that had vaccines that were ready to produce and be tested here in Canada, but the Liberal government ignored them. And still, they failed to support homegrown opportunities. Mr. Sorensen, the CEO of Providence, said yesterday, We're getting contact by probably 2 or 3 countries per week asking if we can supply them with vaccine boosters in 2022. We're trying to get those things moving to convey that urgency, but we're not getting it reciprocated by our own Canadian government. Again, the failures are piling up, and unfortunately, Mr. Speaker, Canadians are the ones paying the price.